Hello everybody from Kuopio. Welcome to the very first Health Talks moderated by Kuopio Health. My name is Kaisa Railanmaa and I work as a development manager in our awesome Kuopio Health cooperation. Kuopio Health is a network committed to promoting competence, research and business in the health, well-being and nutrition sector, and to provide information about the top competence in our region. Our work is based on a model of open innovation. You can find more information from us from our website, kuopiohealth.com.fi. Sorry. In today's webinar, we will dive into the world of artificial intelligence in healthcare. Our speakers are company representatives with various backgrounds, and they all have their own viewpoint on AI. After every presentation, we have a few minutes for questions. Please write your questions in the chat, and we will raise them for the presenters after their talk. And if we don't have time to answer to all of your questions, we will get back at you via email. So, thank you once again for joining us today, and please enjoy the webinar. And Antti Väänänen, the stage is yours. Thank you.
Thank you, Kaisa. So thanks for joining this webinar, and I'm now talking a little bit about artificial intelligence solutions in healthcare. Just a minute, I will share my screen first. Okay, so I assume that everybody sees my screen, and so artificial intelligence and its solutions in healthcare. So my name is Antti Väänänen. I am a CEO in the company, a startup company Vireum, and I'm also working same time as a researcher in University of Eastern Finland, and my research topic and area is artificial intelligence in healthcare. So first, the topics are that first I will tell a little bit about AI, just shortly, and then about its use cases in healthcare, then advantages and disadvantages in healthcare, then a really short business review about AI utilization in healthcare sector and its possibilities, and then about a little bit our company's services and platform. So AI, what it is? It's actually like a computer program capable of performing what is considered to be intelligence functions and usually performed by humans. And that raises a question, what is intelligence and what is not? But we don't deep dive into that. And in many ways, AI is in very early stage of development, and it's not capable of human intelligence, what we think. And it's not yet a substitute for doctors or nurses, but it can process huge amount of data, for example, and identify patterns and things that humans cannot find, and very efficient way of doing that. And then in the future, AI can be a tool and can take a full advantage of digital patient information systems and provide assistance to clinical decision makers. So the stages of AI. So currently we are into the phase of a narrow AI. It can execute tasks, and it's like outperform humans in some repeated functions, and for example in games and so on. And it can make a medical diagnosis in a way that it's like giving like a pre-diagnosis, and of course clinical decision makers and professionals will approve or not approve those, and so on. And then the next step in AI is like a general AI, and it can perform like broad tasks and improve capabilities of humans. So it can like be earning, for example, university degrees, and especially convincing humans that it is also human. It's like the ultimate test for AI. And it's predicted in some ways that it will be reality in 2040. Somebody says that it's earlier, and somebody, of course, that it doesn't never be, will be in the same level that humans are. And then soon after general AI, the super AI can be produced, and it will then outperform human capabilities, and it can have like a really high positive effect for humankind. But somebody also say that it might have really negative effects for humankind, but future will show. And the AI, I have collected here some couple of AI-based solutions, and what AI is normally said that it's consists of different sectors. It's machine vision, machine learning, deep learning, neural networks, speech recognition, natural language processing, expert system, robotics, etc. And the use cases for these methods are like one good use case is autonomous vehicles, and it's really like it has a robotics, it has machine vision, it has like a deep learning, neural networks. Every aspect almost for the AI is utilized in autonomic vehicles. Then in the healthcare sector, it's like a robotic surgery. There is AI utilized in many ways. Then there are these like conversational robots and chatbots. The Sophie robot is quite a nice like a demonstrator for AI capabilities. It can conversate with the humans and keep up the conversation only by using AI, and it has a facial expressions also, and it has many videos in the YouTube that you can take a look. And then in the care homes, for example, there are like nursing robots that can perform some simple tasks, for example, providing medication to patients and so on. And the use cases, there are a huge variety of different use cases of AI in different fields of industry. And but now we are focusing in this time to the healthcare sector, which has also many use cases. And the first use case what I've been talking about is the surgical robots. So they can be utilized in different kind of surgeries. And the benefits for robotic surgery is that it has fewer complications or infections, less pain and blood loss, faster recovery, and smaller and less noticeable scars for the patients. And then it's like virtual nursing assistants is one use case for AI. And it can use information from patient medical history and monitor patient's condition based on the method history, and monitor medical adherence, and provide treatment plan and follow the treatment plans, and track appointments, allowing recurring treatment events without straining existing resources, and providing real-time alerts that can be used for treatment and planning. So the benefits are that it improves quality of care and medical results, and makes that it's less healthcare visits needed for patients. And AI and diagnostic side. So AI is utilized in multiple different diagnoses. It's like a cancer diagnosis and cardiological diagnosis, even psychiatric diagnosis, and also diagnosing infectious diseases in many ways. So the benefits are that improving speed and accuracy of the diagnosis, and the diagnosis can be performed in remote locations, and it allows more detailed pathological results by using tissue analysis, for example. And many types of cancer, this AI-based diagnosis can have more accuracy and faster results than traditional ways. And lowering the costs of the overall diagnosis. And then we go to the medical image analysis, which is a really highly used use case, or like a use case which are used really a lot, and AI is utilized really a lot in this image analysis sector. And there are three-dimensional and two-dimensional images and radiological MRI images where we can provide analysis for different cancers or skin analysis, and also even eye analysis. And in this image analysis and machine vision based analysis, diagnosis accuracy is proven to be a lot better than what can be made by professionals. And the basic use case where AI is better than humans in this are skin cancer, breast cancer, and various eye diseases. And AI in this case also reduces the time to perform the diagnosis, and it's much easier to do diagnosis by this way than by humans. Of course, humans will anyway do the final decision, but AI will help them to do the diagnosis. And then AI is used also in the drug design and drug safety and drug manufacturing processes. It can be used to find new drug candidates, and it accelerates drug discovery for immunology treatments. And then about drug safety, it can be utilized in detection and prevention of medical errors and dosing errors. And in manufacturing side, we can utilize AI to provide like individually designed drugs. And actually, the Google DeepMind just like introduced this AlphaFold, which use this kind of neural network to predict protein folding in three-dimensional way. And the work which scientists has tried to solve for decades, this DeepMind AlphaFold did it in 30 minutes. And this is quite a revolutionary thing what AI has been done in the field of medicine, and it really speeds up the drug and vaccines development in near future. AI can be used also for medical risk assessments, for the prediction of occurrence of cancer, for example, or diabetes, and cardiological diseases and physiatric problems, and also, for example, joints and problems. It can be make an assessment and evaluate the risks. And how long the patients are staying in the hospitals, it can estimate and possibilities for patients to how when they could return to hospital, for example, and the likelihood of the disease, of occurrence of the disease in short and long term way. And then it can be utilized in clinical trials. It can identify small factors that may affect the search results, for example, research results, and what still will be unnoticed by humans in manual work. And its ability to use and handle data faster and more specifically than humans or traditional ways. And it can create predictive analytics for test results. So by that way, the clinical trials can be performed much cheaper and efficiently and provide more accurate results. And of course, these results lead to the development of new drugs and introducing new therapies cheaper and faster. So then about the advantages in healthcare, I have collected here some information about the public survey, which was made by PwC company. And in that survey, there was 12,000 participants. And the top advantage what people said that what AI can provide them is that the healthcare would be easier and quicker accessible for more people by AI. And then advanced computers and robots can make a diagnosis faster and more accurately. And advanced robots with AI will make better treatment recommendations. These are like a top three advantages what was expressed by people. And then disadvantages, of course, the AI will lack the human touch in a way, and the people doesn't trust robots or AI to make decisions. And yeah, it's like people doesn't trust for AI to do correct decisions. And I made my own research for healthcare professionals' point of view, and the major advantages what they considered were that simple and repeating tasks can be performed by AI and robots, and it can provide healthcare help in the healthcare professionals' workload, and so on. There are many benefits for AI in healthcare professionals' point of view. And also disadvantages, they cannot be in contact with patients, and it's too complicated for healthcare professionals to access AI technology and so on. And these are really like in same kind of things what the general public was also mentioning in the earlier research. A business opportunity is quite high, so it's predicted to have a annual growth rate at 44.9 or 45% about, and in this AI-based healthcare technology and the market. And possible savings, what could be achieved by AI is predicted in US only, that it's like 150 billion annual savings by 2026. And that the major part of that will be coming from robot-assisted surgery usage and virtual nursing assistants and administrative workflow assistants.
Sorry, Antti, few minutes.
Okay, yes. So just a few seconds about Vireum and its AI services. So we have like in our company top experts in machine vision and machine learning and data analytics and neural networks, and our knowledge are in several industries, including healthcare industry. And for healthcare point of view, we can provide prediction and detection of diseases, possibility, automatic detection of emergency in healthcare, and medical image processing in various ways. And we have done these projects already. So if there is interest, please keep in contact. Contact me, and we can figure out that how AI can provide enhancement in your business processes. And then we have like a communication platform for healthcare, which can be integrated to company-owned systems and services easily. And it has really a lot of AI-based features, and also the basic appointment and communication features. Yes, so there is some more information about the AI video about explaining AI in 5 minutes, and then one course where you can learn the basics of AI. So thank you, and please keep in contact if you want to know more about our capability to develop AI solutions for your company.
Thank you, Antti, for your presentation. There are a few questions for you. First one is from Janne. If AI create benefits, why is the adaptation rate currently so slow? Is it because of the expensive price, lack of examples, or something else?
What was the rate of? Can you repeat the?
AI create great benefits. Why is the adaptation rate currently so slow?
Yes. There is still like it costs something to of course develop the new features for current solutions what are in the markets of healthcare markets, and that's the reason that when considering the services and software which are like a medical device accepted, and it's always like a big process to add new features, especially AI features, when there are, for example, neural networks used, which is quite difficult to have a medical device acceptance. But I think that that's the major part, and of course it's in a new technology anyway, and always the new technology in traditional business field, it's like hard to penetrate to the markets. I think that these are the things.
Thank you. And then a question from Emma. How accessible for the public the AI medical services? How costly is it for general public?
For the general public, I think that the companies who are providing the services which include AI methods or features, so they price their services by themselves usually. So there are some free services for which utilizes AI, but I don't have now the list here. But it's like there are some solutions which are like can be utilized for free. It's like a kind of predictions and analytics for possibility to have disease in the future, for example, that kind of solutions.
Okay, well, thank you, Antti, for your presentation, and let's give stage to Janne Parkkila. Please, Janne.
Yeah, thank you. Howdy, everybody. Let me share my screen and let's get straight to the point. All right, so I will just put the timer on so I would know when the time runs out. Anyway, so my name is Janne Parkkila. I'm the CEO of Orchestrio, a company here in Finland. And today I'm going to talk about ethics and AI. Just a couple of words about the company. So Orchestrio has our main base here in Kuopio. And what we do is basically we are the creators of digital transformation. So we're helping companies to transform to the digital world. And we especially use artificial intelligence on these processes. And we have a long history in healthcare process management. So we have helped multiple different Finnish hospitals and healthcare regions to create more efficient processes with the use of technology. Couple of words about me. So who is this guy talking today? So actually, like I said, I'm the CEO. I'm also the owner of this company. I'm a Doctor of Science in Technology. So I have a computer science degree from LUT, Lappeenranta University of Technology. I'm also a failed theologian, never graduated from the university, but started studies a long time ago. But maybe this is the reason why I'm so interested about ethics here. Also, I wanted to add something. So I have a hobby. I'm a swimmer, and I've been competing on the European level on masters. So it means that I'm old guy to participate in the normal swimming competitions nowadays. I also work in the Finnish parliamentary group on information politics, so I'm a member of that, and also the international ISO standard on artificial intelligence. I'm a member of the Finnish group on that, so that SFS 315. And also I'm a member of Kuopio Health Board of Administration, and also in the Savo Entrepreneurs Board of Administration. So I have like different aspects on how to use technology and where it can benefit us. Then let's go to the main point. I wanted to talk about artificial intelligence as well. And just a couple of words about how I feel AI fits and works. So in my opinion, AI is not going to replace us humans in the near future. And I think it shouldn't even be our goal. I think AI currently is a good working buddy, but just someone who works as a colleague with us, not to replace us. Because we humans have a lot of like silent knowledge and information that is not available always to the computer, or it's difficult to program into the computer. So like I said, I think we humans are best at understanding the big picture, and computers are very good at doing like hard tasks like mathematical computation, optimizing stuff, looking at lots of numbers and putting them together. So that is for computers, and soft skills like leadership, discussing with humans, understanding big picture, planning the future. These are something where we humans are best. So like I said, AI should collect and combine, perhaps even create alternative scenarios for us, for the decision makers, so we can actually then decide which direction should we take. But like I said, understanding the silent knowledge. So there's a lot of things we know from the workplace that we know how things go, and it's hard to program it into a computer. So this transformation is very hard to do with the computers. And also ethics, values, moral issues, these are definitely not the strong side of the computers. And this brings us to the topic of the day. So ethics of artificial intelligence. I'm going to show you some examples and discuss just like briefly, because we have a limited time, just briefly about the idea what should be the main principles driving these ethics questions. So first of all, I say that it's very important to make sure that the artificial intelligence in the future is something that is objective. It should treat everybody equally. So for example, when you're applying for a loan or welfare benefits or whatever, if there is a computer making decisions about you, it should be objective. So the same rules apply to everyone. It should also be transparent. So we know that we are now dealing with a computer or with artificial intelligence. The computer is now making decisions about me based on some information. And I should be able to know after the decision has been made, what was the reasoning behind this decision? So why did you give me, for example, a negative loan decision? And also it should be understandable. So I should be able, as a human, like a client or person using the AI, I should be able to understand how does it work? Why does it work? What are the main things that make it possible to use this AI? And like I already said, for us humans, it's important to know the data behind the reasoning. So sometimes the data is faulty. There's problems, it's lacking, it's old, whatever is the reason, but there might be mistakes. And I should always have the right to fix these problems. So correct things if they are wrong. If there are wrong assumptions, wrong knowledge, I should be able to fix it. And this brings to the really important question that is called life cycle management. So even though we have really good intentions and we think all these objectivity, transparency, understandability, all of these things in the beginning, but let's say the AI model is running for 2 years. And what might happen in the 2 years span is that new information is coming to the system. We perhaps add new services, our processes change somehow. So we really have to make sure that the model actually reflects reality in our company or in the decision-making process. So if new data comes in and nobody tells, like a normal employee, for example, if nobody tells you or teaches you what to do, how to deal with this new product or this new way of working, if nobody teaches you that, you still keep doing the old way, and that causes probably quite some issues. So making sure that things actually stay the same as they were designed after 2 years, after 4 years, this is a big question, and this is a very hot research topic that is starting to grow more and more in the academy. And what I was just a second ago talking, this is definitely not the way how to do machine learning or artificial intelligence. So this XKCD comic is a very good anecdote to the idea that just pour as much data as you can and let's stir it a little bit, and maybe this file starts to look like something important, or maybe we start getting some sane results in the end. But the data that you pour into the system actually can have lots of biases. It can be skewed, it can be wrong, it can be even very racist. You never know. So make sure what kind of data you are putting there. And now I'm going to show you some examples about this and ethics and what is related to this chains of AI. So, for example, there's somebody talking. I'm going to mute you. Sorry, Tiina. So, example of searches. We are all using Google searches, for example, and we know that it gives us very good results most of the time. And there is a very sophisticated AI, or many AIs probably behind auto suggestions and what kind of things to show you. It maybe understands the context where you are living, stuff like that, and shows more relevant information to you. However, these searches also contain some biases, like you see soon. So let's assume that I'm just searching like a basic word called schoolboy. I want to look like what the schoolboys look like. And this is the result. Okay, nice boys here, some ugly picture here, and maybe a little bit sexist guy there. However, when I type schoolgirl, this is the result. And even on the top, actually, there's advertisements showing like a little bit sexy clothing. So this is definitely an issue. Like what it might work properly, but the data or things that it actually shows you might be a little bit bad, or not, definitely not what we want to show for the society. So like I said, the search engine in itself is probably not sexist. It just happens to uncover things that we as humans are searching. But is this the way we want to really portray the world? Do we want that our children, when they go and do those searches, they get the same results, for example? So these kind of suggestions that search engines show or do, they actually also manipulate the way how we think about the world and which way we're going. So there is a great responsibility here. What do you really show? Okay, let's talk a little bit about another thing, creating art. This is more related to IPs and who owns rights and so on. Huawei, some time ago, finished a Schubert Symphony number 8, if I don't remember wrong. It was a symphony that was never finished. It had the 2 first parts, and then Huawei actually used AI to learn from all the previous songs compositions made by Schubert, and then created the third and fourth part to the symphony. And then it was actually performed by the orchestra, and it sounds very good. I will have all these links in the end also with the slides, so you can go and listen to it. So AI created completely new work of art based on previous history. The same, there is a website called Next Rembrandt. So also the AI was able to create a completely new Rembrandt picture that looks like very, very real. It is actually real, and it's based on the data that it was given. So the old Rembrandt images or the works of art. This is not so much an ethic issue, but an important issue when you consider where does the data come from and who owns the rights. So now that art such as paintings, music, literature can be created or derived or continued, like finishing unfinished works, who owns the rights to these results? Is it Rembrandt, who died a long time ago? Is it the algorithm makers? Is it the computer who actually calculated the result? Or is there even an author? Or what it is? So this is a big question that needs to be solved. And this is something that when you create AI systems, you need to also think, where did the data come from? Who owns it? And who owns the results? Well, next thing is about image recognition. So this is something that has been on the news a lot about facial recognition, and it's a very good thing that now even in USA, big companies are starting to say no to facial recognition and using that. But just to show you what kind of problems can arise from data, even though as humans, we probably don't mean bad things, strange things can happen. So in January 2018, The Guardian had an article. I took the screenshot yesterday, so it says it's 2 years old. But Google had a Google Photos system that was able to like label who is a person and what is a chimpanzee and what is an ape and monkey and so on. And suddenly all Black people started to be labeled as monkeys, which is really, really problematic. Or no, sorry, gorillas, which is really problematic. This is really racist. And definitely nobody even thought about this, but they had only used the photos of white males probably. And suddenly when you introduce something else, this was the closest they could find. So data that was used was really problematic. It was skewed. It didn't really portray the whole human inhabitants of this planet. And this was the result. So what did Google do? They actually banned gorillas. So instead of fixing the problem, they decided that we won't label any kind of monkeys or apes or chimpanzees, which is a weird thing. But anyway, just a problem that can arise. Another thing where AI can do decisions for us is in law. So for example, there is this infamous prediction where in USA they used system to predict how will make new crimes, like subsequent offenses after a history of criminal records. And it was able to make 20% of the guesses correct. And here you have two persons, like this white male guy got low risk of 3, so he's probably not going to do anything bad. And this Black woman here has a high risk of 8, and she's probably going to do something really bad. And when you see what they have done, the lady has done but 4 juvenile misdemeanors, and the white guy has 2 armed robberies and 1 attempted armed robbery. So even my common sense would say something else. But this is a example when you have, even in the legal system, you probably have something built-in biases. So what I want to say is that algorithm is only as good as the data it is trained with. And we ourselves have hidden biases that accidentally end up in the systems, and these cause problems. For me, for example, here, if we start doing like a facial recognition of Finnish people, it probably don't have a lot of Asian or African people, so that it will probably not even recognize them correctly. So we have to think a lot what kind of data we use and for what environment we want to use this system. So what should we do? First, when you create these AI systems, you as developers have really a lot of responsibility. So do stuff that is not equal to everybody, but it's just for everybody. So not all humans are the same. We have lots of different traits. We are different. We have different backgrounds. So think about the results and consequences of the systems that you create. And some ways to fix this is, one, in my opinion, is education. So schools, universities, we need to talk more about the ethics of information technology. And as developers, we have to really think about the consequences our technologies can have. Auditing, so audit your services, create written guidelines, how the AI should work, why is it working, and also maintain those documents and go through them like at least on a yearly basis or something. Go and check that your algorithms still work the way as it was supposed to be. Be transparent. So whenever a human is going to interact with your AI, make sure they understand that they are talking with an AI and why these results that the AI is producing, why they came to be. And also the data quality. Make sure to use proper data, clean it, and use only what is necessary, because data can have hidden biases. Even just using postal codes can have some kind of biases, even though we don't think about it. Because some in USA, lower income people live usually on the same neighborhoods than higher income people. So just using a postal code can have reflections on the backgrounds of the person. Well, this was my short talk. I was able to go it in a proper time. So do you have some questions or comments?
Yes, thank you, Janne, for your presentation. There is one question first from Erkki. How to assess the ethics of IA? Who should do the assessment?
Yes, very good question. I would say the assessment goes at least to the developer, but probably for the person who orders, also the company who buys the AI should also make sure. So I think this is like in European Union legislation, like the GDPR. So the similar kind of way that everybody, the one who is using it and the one who developed it, are both responsible. I have actually a link on the next slide. There's AI Fairness 360 project, for example, that by IBM, that is an open source project on how to assess ethical AI. And there's a lot of more coming. So there is not like a really one good framework yet, but it's in the process. And I suggest you go and check the AI Fairness 360.
Okay. So then there is a question from Anna. So we will face AI revolution, right?
Well, probably no Terminator. I don't believe in that. But I think AI will come as a working, like I said in the beginning, as a colleague to our teams. And my hope is that they will actually take the repetitive burden tasks that we do, manual tasks, like all those Excel reports that we have to do and combine. Maybe the AI will do those for us, give us some recommendations what to do, perhaps alerts if things are going the wrong way, and saying like, hey, Janne, do something, and I think these are your 3 options and pick the best one, something like that. So it should work as a colleague, not replacing us, and probably no Terminators. That's very, very unlikely.
Okay. So then there is still a last question from Emma. So I assume by deep learning, AI can become more rational, thus more precise than humans. We teach AI about community ethics, and as a consequence, we have a better world. How AI ethics thinks about this?
Well, my opinion here is that, like I said, it is very much related to the data that we give the system. And when you give a lot of data, it can find surprising combinations and surprising deductions that we as humans didn't even think would be possible. Well, for Terminator idea, I would just say that if we want to have the most secure system, lock people out of it. So then it's very safe. And when nobody is using a system, there is no problem of security. So these kind of issues can rise. So the computer does something that really does what you asked, but it's not logical in human manners. So I don't think that deep learning alone will solve like this kind of general intelligence. It will be a very good solve like specific tasks, like I said, as a colleague, but not maybe in the next 50 years something more will come and combine with the deep learning, but not alone. Currently, as it is, not alone, not yet.
Thank you, Janne. There are still a few questions, but I think we will get back at them with email as we give stage to Erkki now. So Erkki Soini, please. We will probably take few minutes over time, but I hope that everyone is fine with that. So Erkki, please.
Thank you, guys, and thank you, Antti, Janne, and all for participating here. So let's start the video. Okay, I'm here, and then. Okay, so thank you for participating. My name is Erkki Soini. I come from a company called Easier, and I'm going to talk to you about the effectiveness of the AI-based solutions and how to assess that. And I think this is a very important theme, as well as the ethics and the general perspective to AI where. So basically, we are now looking at the value side of the AI. And who am I? Well, I have some affiliations here. So first of all, Easier. We do health economics and evidence generation mainly. Then Siltana, which is doing mobile application for better management of drug use in real life. Then we have Kuopio Health. I'm member of board of directors there. And you probably know what Kuopio Health does. I have been involved with hundreds of projects related to effectiveness and cost effectiveness. We have received some relevant awards, maybe 4 of them to mention, related to digitalization, have been co-chairing the biggest congress in the world in our field. We have had a notable presentation in cost effectiveness assessments and also have received an award about Bayesian networks and stuff related to that. So this is a busy slide, but what I'm trying to say here, this was really a recent publication, like the 1st of December, maybe this came out. And what we actually were doing here in Finland was that there was a testing of different combinations of anti-cancer treatments. And actually the machine learning was able to find a lot of potentially beneficial combinations of treatments. And this has a high potential for better treatment and value in the setting. And that is really important. So that is the sort of background in machine learning and AI. It is sometimes better than us, as was said. But how to demonstrate that? That is the real question. So if we think about what is the typical type of demonstrating value in healthcare, that is like health technology assessment, HTA. And what that is, it is information for decision making. So we want to support the decision making systems there. We do that always multidisciplinary, so there are clinicians, data scientists, health economists, etc. involved in the process. It is a systematic process. It needs to be transparent, unbiased, and robust. And we need to apply research and science. It is usually based on the evidence synthesis, so a lot of effectiveness, efficacy stuff is collected and maybe meta-analyzed, like with network meta-analysis. And also cost effectiveness evaluation is typically done. Then if we think about what Janne said, there needs to be also social, ethical, and legal aspects involved. So what are the key features of this value demonstration? Basically, there are 2 key features. One is about the effectiveness. This is very popular child, so it has a lot of different terms. In Europe, we call this as relative effectiveness assessment. In the US, it is comparative effectiveness research. And sometimes the authorities say that it is benefit-harm assessment. But it is basically a comparison of existing healthcare interventions like AI to determine which treatment works best for whom and under what conditions. And if we think about the second phase, that is the cost effectiveness assessment. So what that actually does, it combines the effectiveness and costs. So it is not only about the cost side. And there we compare the relative costs and outcomes of different courses of action, like, for example, with AI and without AI. And it is usually used because it is quite inappropriate to monetize the health outcomes. So we need to have life years or some avoided events or something like that in the effectiveness side. What is often done is a cost utility analysis, and there's obvious reason for that, because we want to also compare the outcomes between different, treatment and patient groups. And there we can apply health-related quality of life measurements to, produce quality-adjusted life years. And those qualities, they actually combine the survival to the quality of life over that survival. So they take into account how well the patient is over time. And a threshold value for the cost per quality can be set. Sometimes in the literature, it is set to be 50,000, sometimes 30,000. And it depends on how severe is the disease and what is the medical need there. In Finland, we don't have an official threshold value. We have experienced what is suitable, but there is no official value for that. So if we think about HDA as whole, so basically we have like the 3 steps there, 3 main steps. We need to have some kind of clear efficacy evidence that the AI or some kind of application can actually work in a controlled setting, or we need to extrapolate that from some other intervention which is sort of similar to the one we are assessing. And usually evidence synthesis, like I said, network meta-analysis, which combines multiple studies, is done on top of that. Then we should have real-world evidence. That is, I think, the most common word these days related to healthcare. So the effectiveness in real life. There we apply statistical analysis and do a lot of synthesis with the material. The third step, there is the damn good side. So it is like decision analytical modeling, where we actually, compare what is going to be the expected predicted outcome in terms of cost effectiveness, like value for money, or what is going to be the budget impact. Do we have a third to this? So that is like, doing a budgeting before we actually implement something. Just to, be clear that we can afford that. There are a lot of tools. You can visit the websites. Hda core model is in the right-hand side there, and there are a lot of features there. But I think they are all connected. If you have really good efficacy evidence, effectiveness evidence, and have done a lot of analysis related to cost effectiveness, and then you take into account the ethical, legal, and social matters, you cover it, basically. So no issues there. In Finland, we have really nice system going on in Oulu, which is called as DigiHDA. It is a confidential process, so until it is published, there is no official, the company name or the product name is not in their website, but when it is published, it is obvious that this has been assessed by a third party, by an independent party who can give guidance whether to use this or not to use this. And it starts with the meeting between company and the assessor, and then there is this important phase where you actually file your evidence, meaning effectiveness, safety, costs and cost effectiveness, data security and protection, and usability and accessibility. And if you think then what happens next, it goes to the different experts. So you have the HDA experts, they look at your questionnaires, how you have filled those, and it is important to know how to fill them. And then, and what kind of evidence is the best evidence in different phases. Then they do a literature review and summarize that. Then in the security side, they look at the questionnaires once again, the material you have developed, and then they look also at the cyber security centers general requirements, which are linked in the below. And then the process takes like 2 months maybe, and then you have a feedback meeting. They give you points, 2, 1, -4 for these different 5 aspects you have there. And then you get the score, which can be full 10. Well, your product is recommended without any hesitation, or it can be lower. There can be a few things to consider. If there are many things to consider, you land to 6 points or below, you may withdraw the assessment, so it is not published, or you can plan further actions like collect more evidence for them, etc. And then you have the DigiHDA publication, which is really good for you in a way that it is a third-party assessment of the HDA, the general overall value of your product, and in a way also about its uncertainty. So if it is full 10, there's a minor or no uncertainty in the system you provide. So what has been the outcomes in the HDA assessments? And these can be found from their websites. There are English and Finnish assessment reports. There have been 4, mostly from 7 to 9 points. And the typical challenge there is research evidence related to the benefits of the device or AI. That is scarce. So it is like the effectiveness or the cost and effectiveness side is missing some information. Here I have an example which was done by us. We have multiple publications, maybe 100 of them in our websites. This is one of them. This is actually innovation from Kuopio. The guys in the company have now office in Texas, maybe in the US. They are really doing really good. They have been listed for the US reimbursement. And this is totally Finnish, innovation from Kuopio. Bone index service. And we did a health economic evaluation there. And this is just to show you few important features. First of all, if you apply AI, it is typically related to decision making in the diagnosis or screening or testing or something first. If it is related to that, like in the left-hand side, you need to also do something which is in the right-hand side here. You need to include the disease pathway and the treatments for that. And what is actually really important here is the treatment allocation. So if you have a system which essentially shows how to diagnose better and then how to treat them better, that is really strong one. But you need to do, how we say it, like 2 or 3 stage process or evaluation. And these models in the right-hand side are used for extrapolating the outcomes over a lifetime, because we have a quite nice material for survival, etc. in Finland. So if we think about the takeaway here, we are not a real coding company, so full stack is here like in the given like that. But basically I have like 5 full stacks for you to get better credibility, market access, value, and potentially also success for your innovation regarding DigiHDA, regarding reimbursement, etc. So I think there are like 5 things which are extremely important. First of all, it is always about the protocol. Some say it is strategy, but I say that the protocol and strategy, they are more or less the same. It is very important to assess the need, set the target, and plan accordingly. How you are going to demonstrate the value of your product or the AI. Then the important question is the service design, because sometimes there are problems with the accessibility and security. So it is important to, take that into account. Then the efficacy generation. Some kind of evidence related to randomized control setting needs to be there because it shows that it can actually work in the controlled settings. Then there is also good to have some effectiveness generation. There are, methods how to actually do close to RCT setting with real life material. For example, with genetic matching algorithms. Finally, it is important to show that you are efficient. You need to demonstrate and communicate the cost effectiveness side. There hasn't been many systematic literature reviews about these. I found one quite recent. They had 66 studies of health economic evaluation there, and they said that, okay, the upcoming evaluations require more comprehensive economic analysis to enable economic decisions for and or against implementing AI technology into healthcare. So basically they said, which was too bad, that there is no real evidence if they assess it as, for example, the new drugs are being assessed. But I still claim that it is possible to assess it as rigorously as new drugs, for example. So this was my presentation. Thank you for participating.
Yes, thank you, Erkki, for your presentation. Does anyone have any questions? At least here's the comment from Emma that great firms, congratulations. And thank you for organizing the event. Janne has a question for you, Erkki. So how expensive or long these assessments take?
Sorry, I didn't catch.
How expensive or long these assessments take?
It depends. If you are carrying out RCT, it can be extremely expensive, but basically you need not so many patients because it is quite easy to show that you are efficient if you have a control setting. If you have real world evidence, if you apply for that, for example, through FinData process, and you combine all the registers and you have all the patients from Finland, maybe 20,000, 25,000 for the data. And then it is what you do with the data, because that is at least a half on top of that, because it is sometimes quite messy data. And then you need to do publications, because in the medicine field, publications are important, because that is like you have the outside reviewer for the material that it is actually, at least someone believes that. And I think the most important feature of the WikiHDA is that there's a third party which actually assesses that. And it is like with the medicines. With the medicines, that is done. And if they are sufficient, they get reimbursement. If not, it is rejection. So it is quite clear-cut process there too.
Okay, thank you. And thank you, Erkki, for your presentation.
Thank you.
And thank you all our presentators from your presentations, and thank you for participating our webinar. And I wish you all a very enjoyable day, and thank you. Let's keep in touch. Thank you.
Thank you. Bye-bye.
Thank you all. Bye-bye.